Hello and welcome to the Microsoft Health Common User Interface Patient Journey Demonstrator. The Demonstrator provides exemplar implementations of Microsoft Health CUI guidance as well as being a showcase for new ideas, experimentation, and an artifact for learning and thinking about future developments for the program. You can find out more about the Microsoft Health Common User Interface program at www.mscui.net, as well as download design guidance and controls free of charge for building next-generation healthcare applications. Much of the guidance and controls available feature in this demonstrator. The demonstrator is built in Silverlight 2, Microsoft's rich internet application technology, which allows us to create new ways of visualizing, understanding, and engaging with clinical data. We will now walk you through your end-to-end journey and we welcome your feedback, so please get in touch with us by emailing mscui@microsoft.com. Before starting the scenario, we would like to bring your attention to the navigation bar across the top of the application. This bar tells you about the screen you are currently on and gives some context from the scenario itself. A panel slides out which allows you to jump to various points in the application. The Show Guide button at the top right of the screen presents overlays, highlighting where we have used Microsoft Health Common User Interface guidance and controls, as well as give you some tips about what you can do on this screen. The Scene Details tab gives you more information about the context of this scene and lists the patient safety principles addressed. Our scenario starts at a local doctor's surgery. We are looking at the surgery administrator's screen. The admin has a number of task-related panels allowing her to schedule appointments, check email, register patients, and look at repeat prescription requests. The screen is configurable, allowing the administrator to lay out the panels as she pleases. Expand a panel to see more information, and switch between panels. The schedules offer a collapsed layout, given an at-a-glance view of how busy a doctor's day is and when they have availability. Each hour can then be expanded for a more detailed view. Patients can be easily moved between schedules using drag and drop. As the surgery opens for the day, the administrator receives a phone call from a patient, Mr. Brian Johnson, complaining of chest pain. The administrator searches for Brian and confirms some further details on the phone with him to be sure that she has the correct record. Once she is certain, she schedules an appointment to see one of the surgery's doctors, Dr. Cox, at 8:50 a.m. She then clears the search and moves on to her next task. We now move on to Dr. Cox's screen at the start of Brian's appointment. The doctor's screen contains a number of task-related panels, similar to the surgery administrator's. There are some additional panels too, including a pathology report inbox, links out to various knowledge support resources, and a practice notice board, allowing the doctor to keep in touch with the surgery team. The doctor's screen is also configurable, allowing the layout to be changed and panels to be expanded and collapsed. The patient, Brian Johnson, has just walked into the doctor's office, so the doctor opens Brian's record by double-clicking on his name in the schedule. The patient record view provides high-level, up-to-date information about the patient in a number of panels. Across the top of the screen, there is a patient banner, allowing the doctor to correctly identify the patient. There is also a list of recent activities and consultations, a list of the medications currently being taken, a chart showing the recent blood pressure readings, information about the patient's allergies, lifestyle, and who is currently caring for them. The doctor starts by looking at the medications Brian is currently on. Each panel can be expanded by clicking on the box in the top right-hand corner. The medications list view allows flexibility and customization of the information. We can switch between current and past medications, group by different fields like prescriber, or reason for taking the medication. The level of detail can also be increased and decreased as required. Each column can be resized and sorted on. The doctor can see that last year the patient started taking some medication to help with essential hypertension. The doctor then expands the most recent activities panels, which shows a list of contacts made with the patient. Each item in the list is expandable, showing more information about that consultation. The doctor can see a number of essential hypertension-related consultations and wants to look at Brian's progress over time. He first groups the items by problem. The detail slider allows him to control the level of detail on the screen. Taking the 3 most recent essential hypertension consultations, the doctor drags them over to the comparison dock. He then expands the dock, allowing a side-by-side comparison. Expanding the examination section allows the doctor to see how Brian's blood pressure has changed over time. He can expand other sections for further investigation. Finally, to help confirm the diagnosis and bring all of the information together, the doctor expands the patient charts panel. The patient charts panel allows the overlaying of various datasets, giving a rich picture of a patient's progress over time. Here we can currently see the patient's blood pressure. The doctor can use the time slider along the bottom to move backwards and forwards, expand and compress time. Adding additional charts by dragging them from the list on the left-hand side, such as creatinine and cholesterol, shows that data overlaid. The stacking order of the charts can also be altered, changing which chart sits at the front. The doctor adds medications to the chart and zooms into a spike in Brian's blood pressure and creatinine that occurred last year. He can immediately see a change in Brian's medication caused his creatinine to rise suddenly, and this explains why he was taken off the course and placed onto a new medication. All of the information is also available in a table format. This still responds to the time slider and changes in the list of charts. The doctor decides that Brian needs to go to the hospital for an exercise test where his heart can be observed. He suspects that an angiogram may then be required. To finish the consultation, the doctor clicks on the menu button and then New Consultation to add notes to Brian's record. A form appears and the doctor can start adding information. The form uses SNOMED CT provided by Health Language for encoding clinical information. This allows the doctor to provide very concise, coded notes on the patient that significantly reduce the risk of misinterpretation. The doctor types chest pain in the problem box. This searches for clinical terms and returns a list of possibilities. The doctor picks the correct term from the list. When the doctor selects chest pain, a list of examinations related to chest pain are instantly brought back. The doctor clicks to expand the history section and add some information about Brian's history. When the doctor clicks Find Matches, the text entered is searched for clinical terms and highlights words and phrases that the doctor can encode. The doctor clicks on hypertension and a pop-up appears below, allowing further refinement. A few options are available for finding the correct term. The nearest matching term is shown at the top. Clicking on Nearest Matches shows terms that start with the word originally typed in. All matches show any term that contains the word originally typed in. Expanding a term shows subconcepts. The doctor finds essential hypertension, selects it, and then clicks on the Add Details button. The flyout shows a number of characteristics of essential hypertension that the doctor can use to add more detail. The doctor selects cyclic as the clinical course and moderate as the severity. He clicks OK to save the information. This updates the text in the history box to reflect the selections, and the doctor moves on to the next term. For ease, a matching term can be quickly selected by double-clicking. The doctor fills in the examination results. Examinations can be added by entering the name of the examination and the result and then clicking the Add button. Brian will also require a prescription for glycerol trinitrate. This will help with the chest pains. In the medications field, the doctor enters GTN, which activates a search and brings back a list of glycerol trinitrate medication options. The doctor selects the 400 microgram spray and to take 1 to 2 puffs as required. He also selects a repeat type of acute and a review date in 6 months' time. The rest of the form is completed and the consultation is saved. The doctor can see the updated information in Brian's record. He closes the record and prepares for the next patient. Brian has arrived at the hospital and is currently doing his exercise test. The test monitors the heart while the patient runs on a treadmill. There are a number of stages, each getting progressively harder. The registrar, Mr. Paul Dunton, sees the patients before the test for a brief assessment and then again afterwards to review the results and decide the next course of action. The screen contains some panels for carrying out day-to-day tasks and on the right-hand side a schedule for the day's exercise tests. Whilst Brian is having his test, the registrar receives a message from David Hamilton, the technician overseeing the exercise test, informing him that Brian is showing some unusual results on some of the monitor leads and that the exercise test should stop. The registrar clicks to view a live feed from the exercise test on this screen. The live feed appears and the registrar can zoom in on individual leads by using the drop-down or clicking on a lead. He clicks on lead V4. He can see that the line is showing some unusual readings and replies to the technician, informing him to stop the test. Shortly after, Brian comes back from the exercise test and sits down with the registrar to review the results. The registrar clicks on View Results. The results are divided up into a number of charts, one for each stage, and displayed at very high resolution, as the registrar requires them in a lot of detail to make an accurate analysis. Using his mouse, the registrar can click on a chart and use the mouse wheel to zoom in and out even further. The registrar moves through the charts observing the data. When the registrar sees something of interest, he can highlight the area and add a note by either selecting the highlight tool from the bar above the charts or holding the Control key. Using the mouse, he can draw a box around the area of interest, then type a note. When a note moves out of view, an arrow remains on the screen, showing the registrar that there are annotations currently out of view. The registrar can then click on the arrow to jump back to that note. An annotation list on the right-hand side also gives the registrar a list of all the highlights and a quick way to navigate to each one. After exploring the results, the registrar explains to Brian that he requires an angiogram and quite possibly an angioplasty. He explains an angiogram is a procedure allowing images to be taken of the arteries around the heart, showing any narrowings or blockages, and that the angioplasty involves inflating a small balloon in the artery to open it up. Brian agrees that he is happy to go ahead, so the registrar decides to place Brian on an angiogram angioplasty care pathway. He clicks on Search Care Pathway Library and in the search enters angiogram. He clicks on the angiogram angioplasty result and this opens up a care pathway. The care pathway shows a number of phases required for the procedure. Each phase can be expanded and collapsed, as can the care pathway itself. After a short time, Brian returns to the hospital for his procedure. The care pathway shows that the results of the angiogram are ready to be reviewed. Clicking on Review Results opens the angiogram results screen. The images form a video showing a radioactive substance being sent through the arteries. The video can be looped, and individual frames can be jumped to using the horizontal frame list. A number of tools are available in the top right-hand side allowing annotations to be made. A magnifying tool is also available to zoom into specific areas of the image. The angiogram team select the magnification tool and move it over the image. There is clearly a narrowing. Dragging the bottom right-hand corner of the magnifier zooms into the image even further. The surgeon has decided that an angioplasty is necessary and needs to take a measurement of the narrowing so he can prepare the equipment. Using the ruler tool, he measures part of the artery, which shows that a 9 mm stent is required. Other types of annotations can be made by the team, including inking, and marquee boxes. A full screen mode provides even more space for the images. Every time an annotation is added to the image, the team can see from the list of frames along the bottom where the annotations are, and also from the list on the right-hand side. Clicking an item in the list goes straight to that annotation and highlights it. The team select to view the angiogram from a slightly different angle. And after confirming where the narrowing is, they prepare for the angioplasty. This concludes the demonstrator walkthrough. Thank you for taking the time to watch this video. Please feel free to have a look at the whole demonstrator yourself and explore it further at www.mscui.net/patient journey demonstrator. Please tell us what you think and provide feedback either by emailing us at mscui@microsoft.com or on the forums accessed via www.mscui.net. Once again, thank you for taking the time to watch our video.